Hello.
Hello.
My name is Rebecca Bentley. I'm Head of Nursing Development at Bradford District Care Trust, and I'm incredibly proud to have nominated Krishna for the Lean Champion. As the title of the presentation indicates, he's been absolutely key in driving integration, quality and improvement initiatives across Bradford District Care Trust. I'll tell you how that's been done. We wanted to establish a model that made all the QUIP initiatives meaningful and explore all the initiatives within the QUIP agenda. I think the most important thing for us across the whole organisation was reducing. Am I standing in front of the thing? Shall I go here?
Yeah.
The most important thing for us was to reduce duplicity. I think you'll probably all be familiar with initiatives coming in and people doing something similar, so we wanted to create an environment where we reduce the duplicity and reduce initiative fatigue amongst staff. We didn't want them constantly having something else coming in that would make them think, oh no, something else. It's got to be meaningful to them. So Krishna has worked towards creating an integrated and lean approach and bringing it into strategic alignment within the organisation. We've got high productive penetration in a very short period of time in our trust. This is one of the overarching frameworks and models that we've utilised in our organisation to make the initiatives that we're launching meaningful and reduce duplicity amongst staff. We've created a steering group called the E for E group, and within that group we use this framework to talk about the initiatives that we've got going on. We'll explore those a little bit later in the presentation, but particularly around productive, we'll look at what we're doing and we'll look at using 5 domains within Energise for Excellence to make sure that we've explored everything in a meaningful and lean way. This is our contribution towards a productive series and how we like to approach it. I'll just hand over to Krishna to be able to describe to you what this process is.
Thank you, Becky. Right, so you can see that this is the national picture of the productive series. This came of the siblings of the productives. This is what we adopted and recreated, not reinvented basically, is we pick and choose various modules and developed some other programs, including the productive reception services, productive admin services. And currently we have 100% rollout of productive mental health work across all the inpatient services. And we have 100% rollout of productive community services, but foundation and planning module training for the community services, which we have 189 teams. And we provided a significant impact on the staff morale and productivity. And productive and lean is a common term currently the frontline staff uses on their environments. We are currently using the productive integration, which the NHS Institutes came about for the acute care pathways. And we recently won a £30,000 below the integrating productives with the 15-step challenge and dignity and respect, improving dignity and respect in care initiative, which is a national initiative. On the productive leader, we are rolling out the productive leader programs, starting with our executive management team, starting with our deputy chief executive, and deputy director of nursing and their PAs. And we are currently using the self-development modules for all the productives, not just the productive leader. We are using it for productive mental health work and as well as the productive community services. So this is a part of the training, the lean trainings which we provide for the productives. We use the SDMs for everyone. This is something actually we developed the productive reception services. It came about when we looked at implementing the 15-step challenge to the wards, specifically to our learning disability and dementia services. It came about one of the staff members saying actually, these 15 steps, the first step starts from the reception, not from the ward. So you need to look at the receptions, how they are doing, how they are creating the first impression there. So that's how we had a meeting with the reception services. And we did a frustration mapping exercise. Then this came about a lot of issues and concerns. That's how we started developing these modules. This again, we adopted the productive principles and lean methodology from the NHS Institutes. I had a discussion with the NHS Institute also around this. And we pick and choose some of these modules, like back office functions. It was the PGP modules. So rather reinventing the wheel, so we just tried to use whatever the modules happen. And these are the specific modules we created around reception service, safety and security and customer services.
I think what Krishna's just demonstrated there with the way that we implement productive series within our organisation is we very much make it meaningful to us, and it fits our services that we have, and the staff are involved as well from all grades, all levels. They're all involved in the initiation of this, and it is firmly embedded within our organisation, the terminology and the models and the framework that we use. Krishna's touched briefly on 15 Steps Challenge, which is something else that Bradford District Care Trust is adopting and carrying out over the next few weeks. We're looking at this alongside the dignity and respect, and we're also doing a pilot of the 15 Steps Challenge within our wards and inpatient services, within the dementia ward and within the learning disability ward as well. Is there anything else you'd like to say about 15 Steps?
If you put the next one. Yeah. Yes, this is what we want the bid actually, is to integrate the 15 steps with improving dignity and respect in care. So currently we involve with the local involvement networks and patient experience walkabout. It's involving U3 strategy that currently Trust is having, and we need to have something like an end-to-end view with the links. The executive boards needs to go and see the cases. So what we thought actually, rather than doing a separate walks, why don't we integrate together? So we actually triangulate these three things together actually. The local involvement networks, the executive walkabouts, and the 15 Steps Challenge together, integrated together. So only one walk, only one time we're going and we do this first. And we already developed a protocol for the inpatient service, which is ratified by our executive management teams, and currently we are on the plan to formulate a new protocol for the community services. We almost covered this, isn't it, in the slides, so you can move on. Harm-free care. When it came as a Safety Express, I think it's a 2011, January, something like that. So we were one of the host organization for the mental health. But what we looked, so is there are quite a lot of acute care focus on the pressure ulcers, catheter, and venous thromboembolisms, and slips, trips, and falls. And only slips, trips, and falls is linked with mental health for us actually in our inpatient areas. So we want to look at how it's going to help on the mental health side. So we started linking with West Midlands. They were doing lots of works around creating the mental health science. So we were in the national focus groups for the harm-free care, and we also developed, helped to develop actually the definitions around the safety thermometer, around the slips, trips and falls, and violence, aggression, medication errors, and self-harm. Currently we are focusing on slips, trips, and falls. I will come to that in the next slides. And the pressure ulcers in the community services through the safety thermometer. But we involve the risk management teams within this project. We are also piloting the older people mental health, safe and protective care. Our initial focus is on slips, trips, and falls because we need to integrate the harm-free care with this project. We don't need to do two different projects. One of the reasons we want to take slips, trips, and falls, our dementia wards has got 100% more falls incidents than the next older people mental health ward, which has 100% more than the other wards. So we want to really focus on this, and we are actually targeting, or we are aiming to reduce the numbers of falls by 10% by March 2013. We created a post-falls protocols in place, and we are still measuring it.
This is our integration plan. We've got this on our poster as well, but these are all the initiatives that Krishna is currently leading on and being the driving force for in our organisation. We hope that we have reduced duplicity and we have reduced initiative fatigue as well by creating frameworks that we can use that communicate and cascade information to all staff. This is our Trust's vision, and something that Krishna works very, very keenly to, that it shouldn't be just another service improvement that will run its course and be finished, but it just becomes a way of working that's embedded in practice.